What is menstrual cramp? Is dysmenorrhea also known as period pain, painful periods, or menstrual cramps? Is pain during menstruation. Its usual onset occurs around the time that menstruation begins. Symptoms typically last less than 3 days. The pain is usually in the pelvis or lower abdomen. Other symptoms may include back pain, diarrhea, or nausea. Symptoms of menstrual cramps include throbbing or cramping pain in your lower abdomen that can be intense, pain that starts 1 to 3 days before your period, peaks 24 hours after the onset of your period, and subsides in 2 to 3 days, dull, continuous ash pain that radiates to your lower back and thighs. Some women also have nausea, loose stools, headache, dizziness. When to see a doctor. See your healthcare provider if menstrual cramps disrupt your life every month. Your symptoms progressively worsen. You just started having severe menstrual cramps after age 25. Causes: during your menstrual period, your uterus contracts to help expel its lining. Hormone-like substances, prostaglandins, involved in pain and inflammation, trigger the uterine muscle contractions. Higher levels of prostaglandins are associated with more severe menstrual cramps. Menstrual cramps can be caused by endometriosis. Tissue that acts similar to the lining of the uterus grows outside of the uterus, most commonly on fallopian tubes, ovaries, or the tissue lining your pelvis. Uterine fibroids. These non-cancerous growths in the wall of the uterus can cause pain. Adenomyosis. The tissue that lines your uterus begins to grow into the muscular walls of the uterus. Pelvic inflammatory disease. This infection of the female reproductive organs is usually caused by sexually transmitted bacteria. Cervical stenosis. In some women, the opening of the cervix is small enough to impede menstrual flow, causing a painful increase of pressure within the uterus. Risk factors: you might be at risk of menstrual cramps if you're younger than age 30, you started puberty early, at age 11 or younger, you bleed heavily during periods, menorrhagia, you have irregular menstrual bleeding, metrorrhagia, you have a family history of menstrual cramps, dysmenorrhea, you smoke. Home remedies for menstrual cramps: 1. Taking over-the-counter medications. 2. Applying heat. Applying heat to your abdomen and lower back may relieve pain. 3. Massaging with essential oils. Massage therapy for about 20 minutes can help. Massage therapy for menstruation involves pressing specific points while the therapist's hands move around your abdomen, side, and back. 4. Avoiding certain foods during menstruation. Avoiding foods that cause bloating and water retention can help you. 5. Avoiding certain foods during menstruation. Avoiding foods that cause bloating and water retention can help you. 6. Adding herbs to your diet. These herbal remedies contain anti-inflammatory and antispasmodic compounds that can reduce the muscle contractions and swelling associated with menstrual pain.